Yes. So in the last lecture, we talked about myofascia and we talked about the trigger points. Once we know that trigger point is being relieved, what are the effects we are going to see, what are the indications, contraindications, and also we are going to see the references from which we have taken the slides. Yes. So first thing is effects of myofascial release. So myofascial release is first of all, पहला तो जे patient की complaints होते first thing that the patient will complain of is pain. Yes, say for example, here the patient is telling I am having pain, severe amount of pain. You see that all the modalities that you can apply છે પણ આપણે બીજી modalities છે, manual therapies છે, electrotherapy છે, બધું જ apply કરી લીધું, still it is not getting better. Then you start assessing which part is specifically hampering the or which structure is responsible for the pain. Once you know that yes, this is responsible, or you can palpate and know that yes, you feel compared to the opposite side that the fascia is comparatively tighter. Fascia जो tight हसे तो 100% you can provide myofascial release, and also presence of tender or trigger point. That is also an important indication. So first thing, patient complain as a pain, you check for myofascia. Myofascia if it is tight, then you apply the myofascial release. Second, restore the function. હવે say for example તમને ક્યાંય પણ દુખાવો થાય છે, say for example અહીંયા દુખાવો થાય તો will I use that hand to do any activity? I will not. Why? It is a protective mechanism. જ્યારે પણ pain થશે, pain is a protective mechanism. એ આપણા બોડીને વધારે ડેમેજ ના કરવા માટે વધારે pain થાય. Yes. So if I'm injured somewhere, I don't use that part. If I'm injured in the shoulder, હું એ હાથને હલાવી જ નહીં. Why? Because I don't want more injuries. Yes, that is a protective mechanism of the body. So function પણ ઓછું થઈ જશે. હવે હું shoulder ને ના હલાવું or અહીંયાથી કામ ના કરું તો શું થશે? મસલ ધીમે ધીમે એટ્રોફાઈ થવા મળશે. તો મારું ફંક્શન ઓવરઓલ ઇન્ડિપેન્ડન્સ છે ડિપેન્ડન્ટ થતું જશે. એટલે કે મારે પાછું એને નોર્મલ લઈ આવવા માટે પેન રિલીવ કરવું પડે અને આ હાથને પાછું યુઝ કરવાનું સ્ટાર્ટ કરવું પડશે. Yes, so that is one of the restore functions effects of myofascial release. Increase the range of motion as we described. Muscle નું કામ શું છે કે range of motion ની લઈ આવે. Second important thing, it also needs to go for movements. Yes, so range of motion ક્યારે allow થાય જ્યારે flexibility normal હોય, surrounding tissues normal હોય અને એ full range of motion માં movement થવા દેશે ત્યારે જ possible છે. So that is one of the reason to increase the range of motion restricted હોય myofascia ના લીધે એમાં જ it will be more helpful. Improve the motor performance. Yes, motor performance એટલે કે muscle ની strength ક્યારે આવશે જ્યારે full range of motion હશે. Yes, you have already learned about the principle of lever arm. તો જ્યારે full extended હશે muscle or full stretched position માં હશે, બહુ force ના કરી શકે. Middle range is the maximum force generating range. Yes, so bicep if you talk about 90 degree હશે ત્યાંથી 100% there are chances that the biceps will contract maximum force. Yes, તો full range of motion હશે તો જ તમે full range માં power generate કરી શકો, strength use કરી શકો, and because of that it will improve the motor performance. Flexibility improve થશે, range improve થઈ જશે, તો strength પણ વધારે આવશે. And last is to restore body equilibrium. We talked about yes, the biceps injury છે, after biceps injury trapezius માં જાય છે, opposite side trapezius, opposite side biceps and everything. So આ disequilibrium form થઈ ગયું. Yes, જે normal equilibrium એટલે balance, એક balance કે એક જગ્યાએ MFR ના લીધે or myofascia ના લીધે એક જગ્યાએ constrict થઈ ગયું છે ground substance, એક જગ્યાએ સાવ loose થઈ ગયું છે તો જ અહીંયા constrict થયું હોય. Yes, and this causes imbalance. So imbalance ને સુધારવા માટે or restore કરવા માટે પાછું લઈ આવવા માટે we are providing MFR provide કરશું એનાથી આ જે solid ground substance છે જેલમાં કન્વર્ટ થશે, એ રિલીઝ થશે એટલે બીજી બધી જગ્યાએ પણ જ્યાં ટેન્શન પ્રોડ્યુસ થઈ ગયું હતું એ પણ રિલીઝ થઈ જશે. So that is effects of myofascial release. Yes, myofascial release is a technique we are going to use specifically in few conditions. Say for example, in backache, in headaches, chronic back pain. All this we are going to use extensively. Okay. So muscle જ્યારે પણ injured થશે at that time it will be always termed as strain. એટલે back ના muscles છે specifically back exact vertebral column ની બાજુમાં એટલે કે paraspinal muscles spinal cord ની આજુબાજુ paraspinal muscles and myofascia there gets to clumps or we can say gel form માંથી solid form માં convert થઈ જશે એકવાર convert થઈ જશે it will cause myofascial dysfunction. The myofascial dysfunction will lead to pain, back pain chronically it will happen, so chronic back pain, low back pain and even thoracic pain. Yes, so okay. So carpal tunnel syndrome એટલે કે જેમાં median nerve entrap થઈ જાય, impinge થઈ જાય, impinge થઈને it cannot do its function, numbness, tingling numbness જેવા sensation આવશે patient ને and here we will release the fascia flexor retinaculum tension થોડું ઓછું થશે એટલે median nerve ઉપર compression છે એ ઓછું થઈ જશે એટલે it can easily pass on the information and no tingling sensations can be felt by the patient, so pain will be relieved. Chronic cervical pain, again, cervical region also tend to get for more and more amount of trapezitis that we talked about the condition. Yes, trapezius muscle ma inflammation type, that is trapezitis. Trapezius itis. Itis means inflammation. So trapezius muscle જ્યારે inflamed થઈ જાય, at that time we call it as trapezitis. Chronic cervical pain no એક major reason. Most of the times જ્યારે પણ લેપટોપમાં વધારે કામ કરતા હોય, anything you are reading for prolonged period of time using mobile phone in abnormal posture તો આ મસલ વધારે કામ કરશે, ફટીગ થઈ જશે અને myofascia distort થઈ જશે. Then you have to apply myofascial release if there is a trigger point of tender point. Coming to indications, yes, which are the indications કઈ conditions માં આપી શકાય MFR. So first of all overall એક general rule, પહેલા palpate કરવાનું patient ને. Second important thing, you always try to compare it to the opposite side. Skin તમને લાગે કે yes this is a taut band, then you go for checking of the trigger point. Trigger point મળી જાય તો 100% તમે MFR આપી શકો. If you follow these 4-5 steps it's done. You can apply contraindication but indications general હોય બધા જ body parts not tight, no need to give it tight, it may be indicated. The patient has a complex global or specific pain complaint that does not follow dermatome, myotome, or visceral referred pain. Now, dermatome and myotome, you might be aware, whenever એક spinal nerve, peripheral nerve, જ્યારે spinal cord માંથી નીકળે અને એ એક body નો portion supply કરે એને કહેવાય dermatome. Skin, yes, sensory supply, that is dermatome. Myotome એટલે જે spinal nerve, peripheral nerve નીકળી એ કોઈ muscle ને provide કરે, yes, motor aspect, muscle ને contract કરાવશે. That is termed as myotome. ડેર્મેટોમ માયોટોમ ના કોઈ નિયમ ફોલો ના થાય એટલે સે ફોર એક્ઝામ્પલ પેશન્ટ કે આટલામાં દુખે છે પણ અહીંયા કોઈ સ્પેસિફિક નાવ કે કોઈ એવો એરિયા નથી કે પેશન્ટ that yes this is specific to this dermatome or myotome yes so for that reason normal general છે એટલે આપણે કહી શકાય કે yes might be the fascia is affected not a muscle not a sensory surface yes so then we can apply for more of myofascial release. The patient has an underlying chronic condition that causes tightness and restriction, like fibromyalgia and post-polio syndrome. Both of these are systemic disorders. Post-polio syndrome is specifically for motor aspect. You've heard of polio, yes? Polio, you might have seen advertisements of the same. दो बूंद जिंदगी की अमिताभ बच्चन used to endorse it. Yes. So that is what when polio happens, it is more of motor paralysis and fibromyalgia involves many systemic diseases, systemic involvement of the whole body. અહીંયા underlying બીજો કોઈ cause હોય yes કે motor paralysis થઈ ગયું કે kidney failure or anything else then you need to see if MFR is indicated by treating the condition. ये एक symptom છે કે ઈ જ વાંધો છે. Yes, there are two things. We can either cure the symptoms or we can cure Okay, am I audible now?
Yes, sir.
Okay, the last
Yes,
thing.
sir.
Okay. So contraindications, everyone got it? I was audible at that time. Contraindications समझाई गया? Yes or
No,
no?
sir.
Okay. Indications are clear. Indications were clear, yes or no?
No, sir.
Okay, fine. So contraindications. The first thing is the patient does not understand or respect the boundaries. એટલે કે patient has a problem in treating or patient does not allow treatment. That is, we know MFR આપણે જ્યારે apply કરવું હોય in the assessment part and the treatment part, we need to expose the area. Yes, so expose કરવો હોય area તો ઘણા religion, ઘણી caste allow ના કરે. Yes, for the opposite gender to go and touch the patient or they do not give consent to even expose the part. Yes, treatment માટે part expose કરવો પડે. MFR આપવું હોય skin to skin, from the therapist skin to the skin of the patient. Contact થવો જોઈએ અને પછી જે energy transfer થાય, mechanical energy transfer થશે, which will also create the thermal energy. The patient does not tolerate the close physical contact or touch as we described. Close contact na pasand hoy tyare થાય. Most importantly, males. They prefer, male patients prefer male therapist and female patients prefer female therapist. But at times this is not possible. And because of this, the patient refuses to take the treatment. So patient refuse કરે છે treatment લેવાનું. Don't force them. Don't tell them, you know, this is needed. Take the consent. If they don't give consent, that is fine. Leave the treatment, ask or provide something alternative way of treatment. The patient has an unstable medical condition. Example, unstable angina. Yes, unstable angina hoy, that is unstable. Unstable means that the patient is not able to breathe properly. Yes, so if the patient is not able to breathe properly, then we need to Yes, so if the patient does not understand કે difference શું છે good pain અને bad pain વચ્ચે, at that time we are going to provide we are not going to provide MFR specifically. Yes, also patient ને કોઈ પણ skin condition હશે એમાં we are not going to provide, કોઈ પણ infectious disease હશે એમાં નહીં કરવાનું. Upper respiratory tract infection, for example COVID. Yes, હમણાં COVID નું છે, plus pneumonia. Such infections rapidly spread from the therapist to the from the patient to the therapist. એટલે આપણે પણ infectious થઈ જઈએ. સ્કિન ની કોઈ condition હોય, આપણે directly skin ના contact માં આવવાના છીએ, ત્યારે ઇન્ફેક્શન લાગી જાય ઓર અપર રેસ્પિરેટરી ટ્રેક હશે તો ઇઝીલી આપણે ઇન્ફેક્ટ થઈ શકે. ટ્યુબરક્યુલોસિસ ઓલ્સો વન ઓફ ધ ડિઝીઝ. તો એ ટાઈમે આપણે નહીં કરવાનું, નહીં પ્રોવાઈડ કરવાની ટ્રીટમેન્ટ. લેટ ઇટ બી, વી કેન નોટ હાર્મ આવરસેલ્ફ એઝ અ થેરાપિસ્ટ ઓલ્સો. The patient does not trust the therapist. Naturally, તમને ટ્રસ્ટ જ ના હોય તો you will never do that action or you will never allow the patient patient will never allow the therapist to provide any treatment in the form. The therapist does not feel comfortable with the patient and also the therapist is not giving the consent. આપણે પહેલા જ વાત થઈ, consent is utmost important. If the patient is not providing consent, we are not going to allow him, or the patient will not allow the therapist to touch him, and we should not force it also. After the initial interview and evaluation, the therapist gut response is not to treat the patient. હવે ઘણા બધા patients એવા પણ હોય, you are going to see them and come across them very frequently, જે જેને physical therapy treatment ની જરૂર ના હોય, but they still come to you for, you can say, just spending time. Yes, એક time કાઢવા માટે એ already તમારી પાસે આવે, and they ask for all the treatments you can. Yes, so at that reason, if you feel that no, myofascia is not affected, pain is not there, patient is faking something, at that time you are not going to provide, never provide treatment. ખાલી MFR નહીં, બીજી કોઈ પણ treatment આપણે provide નહીં કરીએ. Yes, so that is the last contraindication, and this is the references that we discussed. Myofascial Release Manual, 3rd edition by Carol J. Manhan. Myofascial Pain and Dysfunction Trigger Point Manual by Janet Travell. Yes, so these are the main references, two main books from which you can find MFR. But starting માં જ મેં તમને કીધેલું that this is going to be more of something that you learn out of the syllabus. હમણાં તમારે practice કરવાની આની જરૂર નથી. You just have to understand the concept, look at the videos, that is more than enough. Yes, you do not need to go in detail about MFR or any other two techniques that we are going to discuss in next classes. Yes, any doubts you have regarding the same, please ask. કોઈ પણ doubt હોય, please ask in the chat, write yes or no.